Back now on Triad Today, and I will bet you, if I were a betting man, and I'm not, but I'll bet you that looking at me right now from home, you have broken a bone at some point, or somebody in your family has. You're shaking your head yes. We have an expert with us now that's going to talk to us about orthopedic injuries that we can all sort of relate to. With me now, Jason Cucchiara. He's an orthopedic nurse practitioner with Northern Orthopedics, part of the Northern Regional Hospital family. Good to see you.
Great. Thanks for having me.
What are some of the common orthopedic injuries that you see in your practice?
A lot of wrist fractures, ankle fractures. We see just about everything you can imagine and some things you can't. So a lot of hip fractures and in elderly, and we take care of it all.
Right. And I appreciate you not looking at me when you say the word elderly. But see, no, but I am. Now, seriously, what can somebody expect if they go to the emergency room with a broken bone? I mean, what can they expect to happen?
Right. Especially this time of year, a lot of injuries occur. People are out and about. Kids are playing on monkey bars and riding their bikes. Emergency rooms can sometimes be scary. Not really the case. It's if you go to the emergency room, you can expect to check in, be evaluated by one of the Northern Orthopedics providers or Northern emergency room providers, and you'll get an X-ray. Very straightforward. He'll evaluate you, and if it feels necessary, then he'll call one of the Northern Orthopedics providers that's on call.
Right. I know you guys simplify things a lot. It's a great facility over there with the emergency department. But now, since you mentioned kids, let's go back to that. It's that time of year where kids are going to go out, they're going to do more playing and horsing around. Any advice you have for parents with regards to orthopedic injuries of the kids?
Yeah, kids are going to be kids, and accidents are going to happen. I would suggest, helmets on bicycles and knee pads on skateboards, and trampolines have nets, and there's safety features. But especially the pediatric athletes that are playing sports right now, basketball, soccer, baseball, if they have a previous knee injury, I would suggest wearing that knee brace, taking that little extra ounce of prevention, and we'll take care of the rest.
Yeah, kids, sometimes we've all been kids, although I can hardly remember. But yeah, we didn't like to wear extra things, but you need to. What's a typical recovery time for orthopedic injuries that require surgery, let's say? If it's a bad break or something, what's the recovery time?
Recovery is such a personalized thing. Some people will do better than others, and there's one of the good things about our department is that we work very closely with our physical therapists and our occupational therapy departments. And if someone is doing better than expected, they walk over and they can say, hey, Jason, this patient we can really probably get them out of the program a little bit sooner. Or if they're not making as much progress as we'd like, they can say, listen, they need a little bit more of attention, and could you come take a look at them right now? And that's one of the great things about our practice.
Yeah, you guys have a great team of folks working together on that. I guess I'm wondering, too, you mentioned, we talked about the kids. Adults of all ages, especially the elderly and others, how do we minimize the risk of orthopedic injuries in general?
I think in general we have to sort of be aware of our surroundings, both in the elderly and with kids, and just put ourselves in good situations and make sure that we're taking proper precautions, especially just sort of keeping an eye on those who are at a higher risk.
Right. I wanted to, before time gets away from us, I want to do a couple things here. For general information about Northern Regional Hospital, you can go to choosenorthern.org, choosenorthern.org. Lots of good information there. Now, Jason, correct me if I'm wrong, though. Now, if somebody wants to get in touch with Northern Orthopedics, you can call 336-719-0011. Is that correct?
That's correct.
Okay, so I'll say it again, 719-0011. We have a little bit of time left. Why did you want to go into medicine?
Well, my grandfather was a pharmacist, and my dad was a pharmacist. And
grandfather from Sicily.
Right. Everyone in my family is medical. My first degree is in journalism. I wanted to be a reporter, but that didn't work out for me.
Come on over on this side. I can't do what you do, but you could do what I do. Hey, Jason, thanks for everything you do and looking after folks. I appreciate it.
Thanks for having me.
Will you come back sometime?
Absolutely.
All right. Be right back after this.